Good afternoon, class. So we are now going to discuss Chapter 1, Part 2, lecture notes. So now we are getting into the anatomical terminology, okay? So we're going to talk about the anatomical position. All right, and on the next slide, you can see a picture of it. And again, the anatomic position is a term that whatever field you're going to, they expect you to know what that means, okay? So body erect, feet slightly apart, palms facing forward, with thumbs pointing away from the body. And essentially, the direction terminology that we will be using, okay, is going to always be based on the standard anatomical position. All right, so let's go to the next slide. And you can see right here, this is the anatomical position, okay? You see how the, you can imagine a cadaver lying flat on his back, okay? Face forward, palms up, okay? Feet slightly apart, okay? That is the anatomical position. And then based on this anatomical position, you do your directional terms. So superior will be toward the cranial area. Inferior would be away from the head. All right, essentially. Anterior is going to be toward the front. You see how this is either at the front or toward the front of the body, and then posterior is going to be at the back or toward the back of the body. All right, and a lot of times you will use this terminology, and you will see it on the exam too, where you will be saying, for instance, the heart is posterior. They might ask you, is the heart anterior or posterior to the breastbone? And the answer would be posterior. Okay, so a lot of times the questions are going to be in relationship to other body parts, but they want you to be able to use the anatomic position and then use the direction from there: superior, inferior, anterior, and posterior. All right, in relationship to that body part. So let's continue. All right, so medial is toward the midline of the body. Anything away from the midline is going to be lateral, okay? And then intermediate is going to be between a more medial and a more lateral structure, so it's going to be kind of in between, all right? And again, you see the examples, they use actual organs or body structures, okay? So the heart is medial to the arm, okay? The arms are lateral to the chest, and the collarbone is intermediate between the breastbone and the shoulder. All right, so here's some more terminology. So proximal is closer to the origin of the body part or the point of attachment of a limb to the body trunk. So usually you think of it as point of attachment to the body trunk. So the elbow is proximal to the wrist, okay? Whichever is closer to the origin of the body part or the attachment to the trunk, okay? And the knee is distal to the thigh. All right, distal is going to be further from the origin of a body part or the attachment to the trunk, okay? The knee is distal to the thigh. The thigh is closer to the attachment to the trunk. Superficial, okay, it's going to be toward the surface. So like you've heard of a superficial scratch or a superficial wound, okay? That's going to be something that's not very deep. It's going to be toward the body surface. All right, then a deep wound or a deep cut, it's going to be something away from the body surface, more internal. All right. And if you want to talk in terms of organs, the lungs are deep to the skin. Okay. All right. So some more terminology. Axial. So it's going to mean the head, neck, and the torso. Okay. And then appendicular is going to be the limbs. All right. The legs and the arms. All right. And then we're going to have regional terms that designate specific areas within body divisions. All right. And so this figure has a lot of terminology. Some of it you would be easy to identify. Some of it may be new terminology that you haven't seen before. But essentially, the head region has, especially when we get to the skeletal system, and even the muscular system, but the skeletal system especially, you know what maxillary means. When you hear that word maxillary, you know that's referring to a certain part of the jaw. You know, when you're dealing with the torso and you hear the word carpal, you know you're dealing with your wrists, and I'm sorry, the wrist is your limbs. But if you heard the word like sternal, all right, you know what part of your chest you're talking about. If you hear the word sternal, all right, umbilical, you've heard that term before. All right, so this figure isn't a figure that you have to memorize. So I know a lot of times students want to know, what do I need to know? It's not that you don't need to know these terminology, but this isn't a figure that I will have on the exam and have you label, essentially. Okay, there will be figures in the next few slides that I would tell you that you definitely need to know and be able to identify structures in different quadrants and things of that nature. All right, and I'll tell you when we get to those slides. All right, so this is just the posterior view, and again, all these terminology, okay, they're consistent. You're going to see the same terminology when you're dealing with the skeletal system. You're going to see the same terminologies when you're dealing with the muscular systems, okay? So, and even when you get to the blood vessels, which is actually an anatomy too, when you get to the blood vessels, a lot of time the blood vessels, arteries, and veins are named according to what region of the body they are in, okay? So if you know the region of the body, what brachial means, okay? And then if you hear the word, brachial artery or vein, you will know what that means, okay? Or you would know what area of the body that's referring to. So that's why it's in your benefit to go ahead and be able to identify the names of these certain anatomical places and structures, because when it comes down time for you to, take Anatomy 2, and you need to know it for Anatomy 1 also, but what I'm saying is you can't just forget it, because when it comes down to taking Anatomy 2, these same regions, okay, are going to be help you in relationship to being able to know what regions, veins and arteries are in, and so forth and so on. All right. So again, these terminologies is very, very important to be able to learn them and use them in your field that you're going into. All right, so body planes and sections. All right, so the three most common planes are sagittal, frontal, and transverse. Okay, and we're going to have pictures in the next slides, and we're going to talk about those in more detail. All right, and then sections are made along a body plane. Okay, and they're going to be named after a plane. So a sagittal cut results in a sagittal section. Okay. All right, so sagittal, for me, it's easy to remember sagittal because I think of mid sagittal. Okay, that's where you make a cut perfectly on the midline. Okay, so when I think of sagittal, I think of mid sagittal, a cut that's perfectly on the midline, and that's going to essentially divide. A sagittal cut's going to divide the body into right and left parts. Okay, so you can have parasagittal planes where you have cuts that are not perfectly centered. Okay, all right, but the way I like to remember sagittal, I just think of mid sagittal, and that's a perfectly midline cut that divides the body into left and right. And then you can have off sagittal cuts, which aren't perfectly midline. Okay, but you still realize that you're dividing the body into right and left parts. All right, and here's a image of that. All right, so the frontal plane. All right, so the frontal plane is going to divide the body into anterior and posterior parts. Okay, front and back. Okay, so sometimes you might hear the term coronal. Okay, coronal is the same as the frontal plane. Okay, so sometimes there are different terminology that mean the same thing. Okay, so don't get confused by that. So sometimes you may see the term coronal, and sometimes you may see the term frontal, but they're the same cut. Okay, it's gonna divide the body into interior and posterior parts. All right, and then transverse plane or horizontal. Okay, horizontal plane, transverse, another word for it, horizontal. It's going to divide the body into superior and inferior parts, top and bottom. Okay, and then oblique section results of cuts at an angle other than 90 degrees to the vertical plane. So let's look at some images of the frontal cut. So you see the frontal cut or the coronal plane right here, and it divides the body into anterior and posterior, all right, sections. All right, so now let's look at a transverse cut. All right, so you see this horizontal transverse cut plane, which divides the body into superior and inferior parts. All right. So you can see all three of them at the same time. And again, this will be something that you will be asked on a test. You know, what type of plane is this? Is it median or mid sagittal? Is it a frontal or transverse? Okay, so you do need to be able to identify different planes. All right. Oh, and also of note, different, like you might say, well, why is this important having these different planes? Okay, essentially these different cuts is because different planes show different aspects of the body. So if you want to have a nice picture of the lungs and heart, okay, you're going to want a frontal cut. All right, if you maybe want to look at the vertebral column, okay, a mid sagittal or median cut might be what you want. All right, if you want to look at some internal organs, okay, you want to see your liver and, you know, in relationship to the pancreas and spleen and so forth. All right, a transverse cut would be what you want. So when it comes to imaging, all right, and using different imaging techniques, all right, these cuts make a big difference of what you can see. All right, so that's also when you go into your field, respective field, something you should also be aware of. That's how you will be applying a lot of times these cuts, as to what aspect, point of view you'll be able to see. All right, so now we're gonna talk about body cavities and membranes. Okay, all right, so you know, our body contains internal cavities that are close to the environment. That's gonna protect our organs within that they're the organs, the cavities are going to protect the organs, all right? And you have two sets of cavities, dorsal body cavities and ventral body cavities, all right? And then one of the body cavities on the dorsal body cavity that's very important to protect is our nervous system, okay? So you have two subdivisions of our nervous system, the cranial cavity, which encases the brain, and the vertebral cavity, all right, which is going to protect your spinal cord, all right? So within the dorsal, meaning dorsal is going to be, think of dorsal, think of the back, posterior cavity. All right. Two important subdivisions, cranial and vertebral. All right, cavities. All right. So, and this is, again, you do need to, this is a figure that you do need to be able to understand, and you will have things that on the exam that you may say, okay, in this cavity, you know, in this thoracic cavity or abdominal cavity, what organs will you find, and so forth. So this is a figure that you need to be well familiar with. But saying what we got to talking about, so the dorsal body cavity, you have the cranial and vertebral cavities. All right, that's the dorsal. And then you have your ventral body cavities, which is going to contain the thoracic and abdominal pelvic cavities. Okay. And in your thoracic cavity, okay, you have your superior mediastinum, okay, right here. You have your pleural cavity, which is going to be where your lungs are located. Your pericardial cavity is where you're going to find your heart, okay? So, you know, below there you have your diaphragm, and then you have your abdominal cavity, okay, which is going to contain your digestive organs, and then your pelvic cavity, your urinary system, and reproductive organs, okay, in the pelvic cavity. So again, this is a figure that you need to be familiar with. All right, you need to be familiar with the dorsal cavities, all right, which cranial and vertebral cavities, and then the ventral cavities, okay, and then what's in those different cavities. All right, so the ventral body cavity, you have your two subdivisions, thoracic cavity and abdominal pelvic cavity, okay? So within the thoracic cavity, you have your pleural cavities, which is going to surround the lungs. And then you have your mediastinum, which is going to contain the pericardial cavity, which is the heart. And then in that mediastinum area, you have other organs, okay, in the thorax area, your esophagus, trachea, and etc. And then you have your pericardial cavity, which encloses the heart. In the abdominal pelvic cavity, you have the abdominal cavity, contains the stomach, intestines, spleen, liver, and the pelvic cavity, urinary system, reproductive system, and the rectum. All right, and again, this is just showing the figure again because it's an important figure, and you need to be well aware of the dorsal and ventral body cavities and what organs are found there, okay? All right, so now you have a body cavity, okay? But so just think of, you know, you have a cavity, so you're going to want something to line this cavity, okay? And so the serous membranes, okay, are going to be what lines these cavities. And you have essentially the parietal serosa, which is going to line the body cavity walls, okay? And then you have the visceral serosa, which is going to actually line the organs, okay? All right, and then the way you can kind of think of this analogy that you can kind of think of is that the parietal serosa would be like if you went into a room, okay, and or a room with walls would be the wallpaper that's lining the walls. The parietal serosa would be the wallpaper lining the walls, okay, and then the visceral serosa, say in that room you have a desk. Okay, you have a desk in that room. The visceral serosa would be if you put some kind of, say, plastic or whatever laminate covering around that desk. Okay, that would be covering that, lining that desk. That would be a visceral serosa. Okay, but then you also need to understand that these serous membranes are double layered membranes. Okay, so they have a little space in between them. Okay, and within that space you have the serous fluid, which is very important. Okay, so especially with things that have movement, like with the lungs and the heart. Okay, pleural cavity with the lungs, and then the pericardial cavity with the heart, because that fluid allows for smoother movement. Okay, and then so issues happen when there's too much fluid. Okay, if there's too much fluid in there, in those spaces, then that can actually impede the movement of your lungs or your heart. If there's inflammation in those areas, okay, those can also cause pain, and it can cause more friction in rubs. All right, with inflammation going on there. So again, it's that term homeostasis is important. You don't want too much fluid. You don't want too less fluid, and then you also don't want that space to become inflamed. Okay, so just understand that there is in between those double layer membranes. Okay, there is a small amount of space. All right, so here's another way to think of it. The parietal versus visceral serosa. So if you had a balloon and you stuck your fist in a balloon that was blown up, okay, the outer balloon wall, the part of the outer balloon that's not touching the fist, okay, the part that's not touching the fist will be comparable to the parietal serosa, whereas the inner balloon wall that is touching the fist, okay, in contact with the fist, which would be an analogy to an organ, okay, that would be the visceral serosa, okay. And you also see in this figure the pericardial space, okay? So you see the pericardial space with the serous fluid located would be right there, all right? All right, so the abdominal pelvic quadrants, and again, these quadrants, you need to also know this figure, the next figure that's going to be coming up with the quadrants, because different organs are going to be located in these different quadrants. And if you know what organs are in the right upper quadrant versus what organs are in the left upper quadrant versus the right lower quadrant and the left lower quadrant, all right, that will help you out also. All right, so again, here's another figure that you should be familiar with. So you have in the abdominal pelvic quadrants, okay, you have the right upper quadrant, all right, left upper quadrant, left lower quadrant, and right lower quadrant. And you see in these quadrants, you have different organs, okay, different anatomical organs are going to be located, all right. So being able to identify what organs are in which quadrant is something that you do need to know. So you use the your belly button to make your four quadrants, okay, to make your crossing quadrants, okay, and then in the right upper quadrant, you find your liver, okay, part of the stomach, a low part of the stomach, the gallbladder, all right, duodenum, your kidney, pancreas, and the right adrenal gland. In the left upper quadrant, okay, you have a little bit of the liver right there, majority of the stomach, some of the pancreas, left kidney, spleen, and the left adrenal gland. The right lower quadrant, okay, you have your appendix, you have your reproductive organs and your right ureter. All right, and in the left lower quadrant, you have the ureter and reproductive organs also. All right, and there are other body cavities besides the one we just named. Okay, you have oral, digestive cavities, nasal cavities, orbital where your eyes are, middle ear cavities. All right, synovial cavities. We'll talk about more when we talk about the skeletal system, dealing with joint cavities. Okay, so this is the end of chapter 1, part 2. So this is in the chapter 1 online lecture.